Fraser Ellis is the independent member for Narungga. Fraser, among other things that have been happening in your electorate, the Malinauskas cabinet have all come to visit town.
It is, that's true. They're all here, have been here yesterday and will be here today. A really welcome thing that we can get the entire cabinet down to present some of the opportunities we have for improvement in the electorate in Narungga and bring to their attention.
Why does it matter that having community cabinet in your electorate? The government has been keen to point out that this didn't happen in the Marshall Liberal government's term.
Well, I reckon it's just important to hear the issues from the horse's mouth. It's one thing to read about the different challenges we face on a fancy letterhead, but once you get out and actually talk to the people that are experiencing these problems and hear from them firsthand, it lets you put a face to a name and a personal element to the issues, and hopefully can trigger some more outcomes and more action.
Now, I want to talk to you in a little bit about the regional housing, because I understand the government has got something to say about that, maybe even today. But these concerning claims that came out from the Nursing and Midwifery Federation about a violent incident that happened at Wallaroo Hospital. Do you know more about this on the local level? What happened, and how close or fortunate a thing it was that the police happened to be on their way to the hospital at the time?
Yeah, I'm led to believe the police were following a second ambulance that was on its way to the hospital as well, so they were, as you said, very fortunate to be there. I'm not entirely sure about the final details. I do know that as part of the country cabinet visit, the health minister and I visited Wallaroo Hospital the morning after the incident, so we saw the damage that was inflicted upon the front of the building there and the efforts that were going into replacing it, and we were able to check with the staff and ensure that there was no harm done to any of them. So everyone was safe. It's a rather scary incident and probably highlights the need for more measures to be put in place to protect those wonderful people that work in our health system.
Well, I noticed that the Nursing and Midwifery Federation have called for regional hospitals to have security staff trained in restraint practices and on-site 24/7. That would come at a cost to the taxpayer, of course, but why has it got to the point we need trained security staff at our hospitals?
Well, I'd hazard a guess, without being an expert in the field, that the increased prevalence of drugs in the community are playing a part in the number of violent incidents that are occurring. It seems, anecdotally at the very least, that there are an increasing number of drug users that are finding access to those things, and we know that once you're on them, it can cause some scary outcomes. So.
Well, I noticed that the government did announce during their visit some additional beds, I think 6 beds for rehabilitation. They said following a medical condition. I mean, what else are you aware the government has announced for the hospital while they've been in town?
Well, so the rehab facility's been underway for a while. It's going to open in a couple of weeks, and that will be for people that undergo relatively major surgery who otherwise would have had to go back to Adelaide to access an occupational therapist or a speech pathologist or a physio or any skills of that nature. So now that Wallaroo will be the host of the only rehab facility in the entire local health network, which is a wonderful addition of services. The LHN has also added an extra day into the chemo unit. So currently the chemo unit only operates 1 day a week, but they'll open that up 2 days a week now and are investigating whether they can upgrade it to a medium-level care facility as opposed to a low level. So that's some excellent local services added to the Wallaroo Hospital recently, and I know they're in negotiations with some more surgeons as well. So hopefully we can get those experts here and further increase the services offered at Wallaroo.
Now, before the election, I think you were talking about a longer-term funding commitment. Was it for Wallaroo or Drossen hospitals or both? Have you got those from the government?
Well, I'd love to have both of them. I think the one you're referring to is the Drossen Community Hospital,
yes,
which is currently operating on a year-to-year basis with funding to augment the A&E department. So being a community hospital doesn't necessarily get any automatic public funding. So if an uninsured patient presents to their A&E, then they're significantly out of pocket to treat that person, and you can't really turn a person away that presents to the emergency department. So that's what that money was for, and we're still on a year-to-year basis, so we'll keep trucking along with that. But also working on a increase of the Wallaroo Hospital. I reckon a 21-bed facility, a population the size of the Copper Coast is just not appropriate. So still working on trying to convince the government to give that facility a big upgrade.
Now, when it comes to, health services are important, but I remember an election forum we had just before the March 2022 election, the importance of population growth to the region, and I noticed that the Regional Australia Institute highlighted the Yorke Peninsula as somewhere where job vacancies jumped 33% in December, the latest available data. It's one of the impediments to getting regional labour. It seems to be the availability availability of housing. Is there some positive news on the horizon when it comes to providing more housing in regional areas?
Yeah, well, I've been told that the government are making an announcement of that in not too much time, so we'll see the detail of that. But you're bang on, it is a big issue, and there are both public employers and private businesses that are struggling to bring in the people they need to provide the services to the regional communities because there's just nowhere for them to live. So any effort that can, for both public and private housing, will be a wonderful addition. And then we've obviously got a shortfall in emergency housing too, with some heartbreaking stories have come to my office of people that have found themselves in difficult times through no fault of their own and just literally have nowhere to go in case of an emergency.
Well, in that sense, when you talk about private housing, I gather what the government's going to be announcing is similar to what they've talked about in terms of rezoning or planning in near the metropolitan area, say at Concordia, just north of Adelaide. Surely it comes down to planning and whether councils have too much red tape in the way to actually allow people to subdivide what might have been a farm or something to put more housing on the edge of town.
I'd suggest, without preempting what it's going to be, that would be the crux of the announcement. And if they can empower local councils to put forward solutions that work on a local level, it's a difficult thing to come up with a solution that works in Adelaide and then apply it to a regional community. It's nowhere near as economic to spend the money to build a full-size house on a rural block because you might not get the same resale value that you would the cost of building, if that makes sense.
Well, I guess it comes down to also, doesn't it? You look at SA Water, we've got an issue in Bordertown at the moment where they've said they can't provide enough water for an industrial and housing development. Doesn't the state government, which owns SA Water, need to sort of come to the party to say, we'll help put the infrastructure in so it's more attractive for a developer to open up that land?
Yep, well, that's what we need. Government. That's what government should do in any case. So it should be empowering business to provide the services to make the communities tick. Hopefully, when they make this announcement, there's steps towards that.
We'll keep an eye out for that. Fraser Ellis, I know we've got to let you go. He's the independent member for Narungga. Thanks for joining us today, Fraser.
Thanks, Ricky. Appreciate it.